I think the greatest thing about orthopedics is that we really can make people better. So much of medicine, you're trying to help them with problems that have become very difficult, and you just try to help them. But in orthopedics, I think you can really make people much better and much better for long-term. Quality of life is better. To see somebody come in who really can't even walk across the room, and then within 6 weeks or so they can walk unlimited distance, and see them smile again about that kind of thing is enormously rewarding. I think I love surgery, working with your hands. I think orthopedics obviously has a bit of a sports relationship, so that's always fun. But the more you get into it, I think the greatest thing about orthopedics is the positive impact you have on people. You can really make people better with orthopedics, which is nice. We have to be real about what our expectations are. Not everybody is going to recover as well as the best case you've ever heard. You have to be realistic about your abilities. And I think if you'll focus on that and have realistic goals, realistic time frames for recovery, I think most everybody's going to do great. I hope that we've developed a track record of good patient service, good outcomes, maintaining cutting edge type technology, but applying it in the real world. And I think that is what we've done best. Well, I think we've got 70 or 80 of some of the best people you can have working here. I think essentially everybody has bought into our philosophy of good patient care, but in a very realistic manner. They're great to work with every day. I enjoy coming to work. And again, seeing somebody who couldn't even walk across the floor walk in and out of the office and smile again is about as rewarding as it can be.